Good evening, ladies and gentlemen. My name is Dmitry Olshansky. I am a psychoanalyst from St. Petersburg, and I would like to say a couple of words about homosexuality. I was frequently asked whether is it possible to cure the homosexual symptoms. So, beforehand, I would like to mention that it's not a kind of illness or mental disorder. That is why it's not our goal to treat or cure the homosexuality. Thus, it does not become an object of interest until the patient himself or herself complains about his or her sexual orientation. There are different approaches to homosexuality in psychoanalysis. On the one hand, we have Ernst Kree's point of view, who argued that homosexuality to be as usual symptom as any other. There is nothing extraordinary in that. I just wonder what does it mean any other symptom. Does Chris means that homosexuality is like arachnophobia, could rise and fades during the analysis depending on the direction of treatment or not? It's just a question. On the other hand, Jacques Lacan, who after Freud considers homosexuality to be a kind of perversion, although it is not disorder, but source of cultural development, as he said. Just look at his seminar on transference of the year 1960-61. Lacan is sure that it is quite easy to cure the homosexuality, therefore nobody do that. So, he explains homosexual orientation as the breaking of 3 steps of Oedipal relations. In such a way, female homosexuality appears at first step of Oedipus and the male homosexuality at the second one. Therefore, correct treatment in Lacan could help to grow the Oedipal relations up to the 3rd step and cure the disease of homosexuality. He never pathologized or stigmatized the sexual orientation directly, but at the same time he gave us some clinical examples how homosexual patients became heterosexual due to analytical treatment, but no one example how heterosexual patient could become a homosexual. In such a way, we could conclude that homosexuality is not the usual symptom like any other. It is quite a specific symptom that he mentions to be a kind of disorder of a second state of Oedipal conflict that should be treated. Lacan supposed that completement of the Oedipal complex and elaboration of the conflict will make the patient heterosexual. What about my own clinical practice? I could agree that it is possible to treat the homosexual symptom if the patient signifies it as a problem for him or for her. Let's take an example of a neurotic case of homosexuality which I have presented at the Congress of the International Psychoanalytical Association in London in July 2019. The patient, Irene, is a lesbian girl who complains of her sexual addiction to women. I asked her, what do they have to attract your attention? And she answered that she is fascinated by the femininity which she herself does not have. After that, she explains femininity as a complex of special qualities like tenderness, warmth, care, sensuality, proximity, emotional understanding, and so on. And several seances, she continues to describe how she was charmed and seduced by the femininity of her girlfriend and other women. From my part, I discover that all these qualities are out of gender at all, and I found nothing female in her femininity. And I asked, what about male femininity? It was a surprise for her, and in a time she agrees that men also could have femininity. On the next seance, she describes male femininity as a courtesy of behavior. Gentleman is a kind of male femininity, she said. What have I done with the help of such interpretation? I have divided female and feminine. That is, separate imaginary gender and the symbolic one, symbolic construction. It shows us that the feminine is the out of gender quality. With the help of such an interpretation, I have deconstructed her enjoyment of the femininity and assist to elaborate her addiction to women. Of course, one interpretation could not complete cure of the homosexual symptom, but it helps the patient not to fall down into the fascinating by her symptom. Here we have an example of neurotic homosexuality. Psychotic cases are much more complicated and difficult to treat, if it is even possible. The case of Irene shows us that the subject has passed two steps of Oedipal conflict. First of all, she has separated from the maternal totality, and secondly, she has accepted the idea of differentiation between men and women, and the choice of the sexual identity has been made. But the choice of the sexual partner was dictated by the enjoyment of the signifier, femininity, which the other women have, but she herself lacks. Therefore, we deal here with a hysterical structure of psychic, which is possible to treat that master signifier femininity which overloaded by the libido. In conclusion, I have to say that from the ethical point of view, it is impossible to pathologize the homosexuality and consider it as a disorder. Our ethical position to symptoms should consist in understanding the meaning of the symptom. Each symptom signifies something. And first of all, we should learn and to understand what the symptom about. What does it mean? What does homosexuality means for that patient and his psychical structure? And only after that, it is possible to choose the direction of treatment and way of interpretation. So I thank you for your attention and would be glad to answer any question you will ask me. Thank you very much.